Sometimes work can make us feel really stressed. In fact, 47% of employed Canadians perceive work as the most stressful part of daily life. Feeling this way may not be a fleeting thing. We might start to see that workplace stress is affecting our whole lives and our mental health. Given that most adults spend a large portion of their lives at work, work-related stress can have a strong impact on mental health and other health outcomes. In this video, we are going to discuss work-related stress and mental health informed by a sex and gender-based analysis. This video is part of a series about the importance of a sex and gender-based analysis approach to mental health in the workplace. The series contains episodes on specific topics with explicit considerations for men, women, and people with diverse gender identities. We also encourage you to view the standalone episode on sex and gender-based analysis. You might have heard of sex and gender-based analysis, or SGBA, before, but you may want to understand more about what it means in connection with stress and workplace mental health more specifically. We'll first briefly describe what is stress and its relationship to workplace mental health. Then we'll describe why it's important to take an intersectional sex and gender approach to it. We'll look at some examples of people's experiences of stress and workplace mental health. Next, we'll identify some promising practices that can be used to help employees with their stress and mental health. We'll let you know briefly how the COVID-19 pandemic has impacted stress and mental health. And then we'll get into a specific example. First, a bit of background.
What do we mean by workplace stress and its relationship to mental health? Workplace stress can lead to physical and mental health changes in healthy people and aggravate illness for those people with mental or physical health issues. The International Labour Organization says that work-related or workplace stress is determined by workplace factors, such as how work is organized. Work-related stress can occur when the content of work, such as long hours, tight deadlines, heavy workloads, and overall high job demands, are too much for the capabilities or resources a worker has. Work-related stress can also be caused by factors related to the work environment or context, such as organizational change, changing reporting structure, and increased job insecurity. These factors are sometimes referred to as psychosocial factors or hazards. Canadian employees see workplace stress as the primary cause of their mental health problems, with depression and anxiety as two of the key issues that emerge. For example, workers who perceive most of their days to be quite a bit or extremely stressful were shown to be over 3 times more likely to suffer a major depressive episode. On the other hand, reducing stress and ensuring better psychological health and safety in the workplace can result in greater employee satisfaction, engagement, and productivity. It can also decrease employee turnover, lost work time, and health costs. Workplace stress and mental health is also affected by the sex and gender of workers.
What is an SGBA lens and why is it essential to a discussion of workplace stress and mental health? In brief, sex and gender-based analysis, or SGBA for short, is a tool or a way of thinking about things that helps us to examine sex-based and gender-based differences and similarities and the consequences for the people involved, some of which are harmful or unjust. It's kind of like a pair of glasses that lets us see things which often go unseen. SGBA allows us to understand that neither sex, which focuses on biology, nor gender, which focuses on the social and cultural, are independent of each other. They are closely intertwined. Sex and gender and other aspects of identity, such as race, ability, cultural identity, and age, also intersect with each other. As Kimberly Crenshaw describes, Intersectionality is a prism for seeing the way in which various forms of inequality often operate together and exacerbate each other. Systems of privilege and oppression act on individuals represented by their identities to produce advantage or privilege or disadvantage, such as racism and sexism. For more details, we encourage you to view the standalone episode on sex and gender-based analysis. Mental health and the workplace are both heavily shaped and influenced by sex and gender, as well as by other aspects of identity and intersectionality. Applying SGBA to examine mental health in the workplace is essential for both employees and organizations to support employees' mental health. Now, we will look at different experiences of work-related stress that people have.
There are a number of important gender differences in workplace stress to recognize. For example, Canadian women report higher levels of work and life stress and face a higher risk of burnout. Psychosocial hazards impact women more frequently and contribute to their experiences of stress. These contributors include the multiple roles women have at home and at work, women's gender roles and social expectations of them, gender-based discrimination, also evident in women's lower wages and higher job expectations, and a higher risk of gender or sexual harassment at work. By contrast, men are less likely to think that stress is having an impact on their health, and they are also less likely to recognize the need to manage their stress. LGBTQ+ individuals may be impacted by self-shame and the stress associated with hiding lesbian, gay, bisexual, transgender, and queer identities. When out, they may then experience discrimination and victimization. Such stress can result in anxiety and other mental health problems. LGBTQ+ people are at higher risk of suicide, substance abuse, and deliberate self-harm than cisgender and heterosexual people. Racialized workers encounter greater workplace stress as a result of structural racism, inequities at work, and racial discrimination. Black workers experience more stressful psychological work environments and as a result have poorer self-rated health. Indigenous employees also experience high rates of work-related stress due to racism, discrimination, and micro-incivilities, where trauma related to the legacy of colonization are minimized by coworkers. These forms of bullying may result in chronic stress for Indigenous workers. Persons with disabilities are more likely to perceive their job as contributing to their levels of stress compared to those who do not have disabilities, 62% versus 41%. Clearly, work-related stress and mental health are influenced by sex, gender, and diverse identities. But some promising practices could address these disproportionate negative outcomes. Managers and organizations can adopt a number of promising practices to begin to address work-related stress and mental health. Although practices can have different effects on diverse employees, some practices show promise. 1. Familiarize yourself and observe relevant legislation. National occupational health and safety regulations require employers to take all reasonable actions in establishing and maintaining psychologically healthy and safe workplaces. The National Standard of Canada for Psychological Health and Safety in the Workplace provides a voluntary guide for organizations to promote mental health and prevent psychological harm at work. Although these do not as of yet take an explicit sex and gender lens, they are a good start. 2. Encourage managers to take workplace stress and mental health training. An online Australian training program for managers called Head Coach resulted in a significant improvement in managers' use of strategies to prevent and decrease stress among their team members. 3. Establish SGBA-informed mental health promotion and stress reduction programs that take into consideration differences in participation and engagement. Adopting or adapting workplace health promotion (WHP) programs that are sensitive to gender and other identities can help ensure greater employee engagement. Women tend to have higher participation levels in worksite health promotion programs. Using the language of sports, for example, mental fitness, rather than social isolation or mental illness, can attract more men to participate. 4. Develop sex and gender and culturally sensitive employment assistance programs. These can help to meet the needs of employees of different gender, race, and culture. The Manitoba Blue Cross Employee and Family Assistance Program, for example, incorporates Indigenous counselors and dedicated Indigenous resource consultants. The impact of COVID-19 pandemic on work-related stress and mental health is becoming clearer. Early research finds many employees are experiencing a significant increase in work-related stress. Early research suggests that the COVID-19 pandemic has had a greater impact on the mental health of women, with studies showing them experiencing a greater amount of stress, anxiety, and depression than men. One of the reasons for these elevated levels of stress and anxiety is concern about workplace exposure to the coronavirus. People with higher exposure risk jobs, such as frontline healthcare workers, are more likely to show high levels of anxiety, 32.8%, compared to those with lower exposure risk jobs, 24.4%. For many, stress might have increased as a result of having to manage an altered workload, or having to adjust to a different workspace at home or a work schedule. Stress related to work-life imbalance has also been affected with a differential impact on women, especially mothers. Employment uncertainty and related financial worries are leading to higher levels of stress, anxiety, and other mental health issues. Employees who have lost jobs or have been laid off have a greater chance of experiencing moderate to severe levels of anxiety and are more likely to report feelings of loneliness in comparison with other groups. Given that workers in gender or racial minorities are more likely to be precariously employed, they will experience greater stress and anxiety related to actual or potential job loss. We encourage everyone to think critically about existing ideas and make use of sex and gender-based analysis to determine the impacts of the COVID-19 pandemic on workplace stress and mental health. Next, let's take a look at one person's experience with mental health and stress at work.
My name is Nibish. I am an Indigenous woman. I work in a Canadian government office located in the Prairie Provinces. I'm a hard worker and I like my work. Recently, I've been finding my manager's expectations are unreasonable. She wants me to complete many tasks that are very time-consuming within very tight deadlines, and it's making me feel stressed. My manager also said some things that I think are disrespectful of me being an Indigenous person. For example, recently she said in a meeting that it doesn't take as long as 7 generations to do the work on a project, and laughed at what she said. That was a reference to my culture, and she thinks the things she says are funny, but to me, they're not. Unfortunately, my colleagues who are not Indigenous also think she's funny. They are saying I don't have a very good sense of humor. I shouldn't take her comments seriously and just do what I can. I've been trying to ignore the comments and continue to work as hard as I can to accommodate my manager. So I'm now taking my homework with me. It's difficult to do the work at home. I have 2 kids who need my attention. My little one is only 3 and he needs me. My teenager says he doesn't need me, but really he does. Although I try, I'm finding it very difficult to work when they're awake, even if I say they can watch TV. So now I'm working late into the night, but I'm feeling mentally exhausted and so very tired. I think I've also started to have anxiety attacks at work. I feel panicked and I can't breathe. My body feels awful. I tell myself that this will pass, but it makes me feel really scared for my health. I was thinking about asking for help through the EAP that they offer through work. I don't think the counselors know anything about the experiences of Indigenous people. and I'm afraid they'll not be able to provide culturally sensitive services, or they won't understand me and tell me I'm making things up. They may not think I have a sense of humor as well, but I really need the help.
Applying an SGBA lens to the issue of workplace stress and mental health is an important step in better understanding the situation described in the vignette. It will help you to address it appropriately with the employee and ensure actions that are fair. Based on the vignette and using the evidence you have just read, think about how Nibish's intersecting identities, being Indigenous, a woman, and a mother, impact her experience of workplace stress. How do the managers' and coworkers' responses to her identities shape the way they treat her? Think about how workplace culture might contribute to employees' experiences of stress and mental health issues. For example, an Indigenous woman who works in a work environment that is racist, a department that has few stress reduction strategies for employees, or little support that is culturally sensitive. Understand how harmful stress is caused and why some employees are deeply affected. Reflect on what you and your team members might be doing or saying that might be impacting the employee's stress and mental health. A final thought. As a manager, think about your employee's life as part of a larger context before you come to any conclusions or make any plans to address the situation. Think about looking at an employee's stress and mental health using the evidence of sex and gender and other identity factors to understand how work-related stress can harm an employee.
We hope that this episode makes it clear that applying an SGBA lens is essential for both employees and organizations to support employees' mental health. Other episodes in this series address other mental health in the workplace concerns from an explicit sex and gender lens. The full series can be found on this YouTube channel and links to the text-based toolkit at the Healthy Professional Worker website. This video and the series is derived from an SGBA policy partnership between the CIHR Institute of Gender and Health and Health Canada and the Public Health Agency of Canada.